Good afternoon, everyone. I hope you're all enjoying the education sessions. Wonderful, wonderful. That's the way to do it. So, with me is Dr. Sandra Newton, which was introduced to you earlier. We are presenting on reflections from patients with sickle cell disease in Ontario on their hospital care experiences. You were here, for those who were here yesterday, we did talk about the quality standards for sickle cell disease, and which is one of the reasons why to help reduce the suboptimal care that patients do get. But then as an organization, we decided to actually put together reflections from families on the quality of care that they do get in Ontario hospitals. So there is no conflict of interest for both of us to declare. So just for you to, as mentioned, sickle cell disease is a lifelong condition, and we know that it's it's a complex medical and psychosocial condition, and which requires frequent interactions with the hospital system. Most of our families will interact first through the emergency department, and then they might then go into admission and outpatient care. Given that as a patient supporting organization, we do receive a lot of reports from patients on the quality of care that they get in hospitals. Sometimes it's positive, they are very happy, and most times it's negative, which also helps to highlight the different variations in quality of care depending on which hospital you go to and which healthcare provider that you're seeing. So again, due to this reason, we decided that we need to capture the patient's perceptions on the quality of care that they are receiving through this pilot study, which is a survey that we collected between July 2019 and February 2020. The objectives of this study were, number one, to explore patient care experiences around optimal and suboptimal care. Number two, identify the hospitals and teams that might benefit from additional education on sickle cell disease care. And that's part of what actually informed the SCAGA models that healthcare providers are now taking, and also to help inform the development of targeted resources and recommendations to improve quality of patient experiences.
All right, with that, I'll just spend a moment or two talking about the how of the study and how it was conducted. Methods-wise, we had an online survey, and that was just meant to increase accessibility by folks around the province. 46 items, self-reported, and it was meant to capture a single visit per entry, right? So we would ask folks to report on their own experience, or if they were caregivers of minor children, to speak about what happened for their child. And when we look at all of the items, and I think I share a bit more about it here, some major themes of those were around time to treatment, really important when you're in the waiting room. We just heard about pain relief and the need to have that in place as quickly as possible. So time to treatment, or at least perceptions around it, the type of treatment received, the quality of care, and again, these are our judgments of the respondents, their perceived healthcare provider empathy and knowledge of sickle cell disease. Sort of difficult to tap and very much subjective, but what we asked about. And this slide just shares with you just the breakdown. There was both qualitative information gathered for those who chose to provide it, and a number of quantified items, main concerns, and satisfaction ratings among them. And then we did, for the qualitative analysis, we looked at the sorts of open-ended responses we received. Not everybody did provide those. That is something we noted in this study, just sort of those gaps and how to knit a story together from them. But we did determine some codes that we'll be sharing on a future slide about the kinds of codes emerging, was lifted from the quotes, and then also doing some comparison. And we kind of divided the group into those for whom expectations were met or for whom expectations were felt to be below personal standard. Just as an explainer here, this is how we divided that group. We actually ended up putting the met and exceeded together, and the below expectations in the red stood on its own. And so with that group division, we started looking at the patterns emerging. All right. I mentioned themes were drawn from the quotes themselves, were available. If we go from right to left, you'll see what the ultimate sort of categories were and how we got there. Pain management being a major theme, as you might imagine. We were talking about people's healthcare experiences, and they tended to report those that were around pain episodes. Treatment by the healthcare practitioner, another major theme, and feelings while in hospital, trying to capture just sort of that impact of the healthcare experience and interface with providers and how people felt. With that, I'll move on and get into the themes a bit.
Thank you. So, as Dr. Newton mentioned, there were different themes that came out of the study. The first is pain management, and under pain management, where we also have sub-theme, which is pain in time. We also have treatment by healthcare provider, and also we have feelings while in the hospital. So going with the first theme, which is the pain management. So we find that 63% of those respondents who believe that the quality of care they've received is below expectation, as well as 50% of those who believe that the quality of care they receive either met their expectation or exceeded their expectations, reference pain a lot. So when we talk about pain, we talk about crisis, medication, in their open resources. So just to give a quote from one of the respondents who felt that that the treatment they receive was below expectation. This individual said it's not an enjoyable experience being in pain. And I would appreciate there being a better protocol, especially when an individual is in extreme pain. So they didn't think that the protocol worked for them. And so also someone who felt that the care that they've received met their expectation, felt that the nursing staff, so what's more about the nursing staff was attentive, and also they adhered to the sickle cell protocol by inquiring about pain and the need for medicine every 2 hours or so. So this person felt that they were listened to and they were being attended to. So with respect to time, you find that those who believe that the quality of care they receive actually was below expectation are mostly from the adult population. And their report was mostly around dissatisfaction around wait times. The time that people report goes up to 8 hours of not getting, pain meds. So time to pain medication administration, and they sometimes do not feel that the attending clinician understand their pain severity. Others also noted inconsistent delivery of pain medication. And those who believe that the quality of care they receive, met or exceed their expectation are mostly from the pediatric population. And they're pleased with the quality of care that they receive, and they noted that pain medication was provided in a timely manner. So it was about timing and also understanding of the severity of the pain. So from an adult, from the below expectation group, indicated that waiting over an hour for pain medication is ridiculous. And we noted that the range, goes from about 15 minutes in some instances, and that those who receive pain meds in about 15 minutes will be mostly those who feel like the quality of care they receive met expectation, to about 8 hours for some individuals. So the second theme is treatment by healthcare providers, and it's talking about competency of healthcare providers and their response to patient concerns. So we find that those who felt that the quality of care that they receive is below expectation, felt that they needed to argue and debate before they could have their needs addressed. And so having their concerns ignored was big on what they were quoting, especially in the context of relaying pain or the need for analgesia. They didn't think that they were believed about the severity of their pain or even if they have pain at all. And those who felt that the quality of care they received met expectation described the healthcare providers as competent and also attentive. They described the healthcare providers' demeanor, noting positive interactions, and describing staff as attentive, empathetic, and respectful. Again, I'm going to give a quote from a caregiver who did not feel that the quality of care their daughter received met expectations, said that the doctor thought she knew what was best for my daughter and didn't want to hear anything. The doctor told my daughter that she wasn't really in pain, so it sparked a big debate. And a respondent, another caregiver who felt that the quality of care met the expectation, felt that the care they received was excellent, the doctors and nurses were very helpful, ensuring my daughter received the best care. They regularly updated us on her condition and treatment path forward. I was with my daughter through our admission, and this helped to erode any fear from her. Now, the last theme was feelings while in the hospital. It was largely around discrimination, and those who did not think that the care they received met expectation they had concerns that they were labeled as drug addict for requesting analgesia, and those who felt that the quality of care they received met their expectation discussed discrimination in a broader context, more referring to other people being labeled as drug addicts, but they themselves did not encounter this while they were in the hospital. So again, quoting an individual who provided that they didn't receive quality care, said, when I said I needed to control pain before going home, the HCP said, no, that's for drug-addicted people. There is also a misconception that patients who frequent the hospital for sickling are drug addicts. Thank you.
Okay, with that, we had an opportunity just to reflect on this study, preliminary in nature, but I hope all agree important to ask the questions and understand what expectations and priorities of patients are, even as you settle on the best way to study it. There were a number of strengths I think that we can lift from this, even as we battled with size of sample and all the rest. Definitely some value in thinking about patient reflections and quantifying those, and also gathering what we can from quotes provided. And really, again, I've mentioned our challenges with numbers and complete data sets, but I think we're striving in institution of things like quality standards and the rest to have some consistency in patient experience, aren't we? And so this gives us some insights into what we might need to do to increase the likelihood of some patients walking in and experiencing expected care, inpatient or outpatient. And of course, this was done before the Ontario Health Standard came on board, and now we have another measuring stick to use. I did mention our challenges with missing survey data, something we will address in our steps forward, and recall bias, obviously something to think about. We're asking people to report on a particular event. We don't have a lot of measuring room around how long out from that event, and even whether they're thinking of that discrete event versus all of their experiences. Very tough to separate those out, although important to try. When it comes to current and future directions, we have lots of plans, as you might imagine. It's so important to gather our anecdotal feedback into some systematic way of looking at our patient experiences and to build from that. So many great things have happened, I'll say quickly. We have the health quality standard mentioned, and SCAGO was a huge part of helping that be shaped, drawing again from experiences like these. We now have biannual touch points with our hospital partners, a lot of proactivity involved so that we can discuss these pieces of feedback and talk about what we're going to do to move forward differently. We have a number of training and educational resources on our website that practitioners can access. I mentioned our well-being coordinators, and we do have a few here today for GTA, for Windsor and London, and we're looking for points north and Ottawa to come. So those are folks that are going out again and trying to improve the experiences patients are having in real time. And of course, a follow-up is planned. We need to survey folks and do it using the learnings from this experience, so that we can better capture experiences and plan forward. I'll leave that with you.
So this is our last slide. We wanted to thank those who participated in the study. We have Dr. Kirby here today, Dr. Susan Williams, Dr. Madeleine Behovsek, Chloe, Corey Fletcher, Tanvai Menhas, Indra Teng, Patricia Defor, Dr. Sandra Newton. And we also want to acknowledge Dr. Jennifer Bryan, Mami Dakwa, Soji Demitoller for their contributions and support of this study. Thank you.
Awesome. Awesome. Are there any questions for Ms. Lannery and Dr. Sandra Newton? There's got to be one. Perfect.
Thank you. That was really good. I like that you actually did this survey and get that information from patients. My question is, did you find that patients' knowledge on the disease or the disease management related somehow to the rating they were giving?
I believe that most patients do understand, sickle cell disease and how it affects them and what quality care they need. They know they need to get pain med within a certain time based on the standards. When they are not receiving that, or when they are hearing side talks, that is when there's a problem. So patients have reported things like, I'm hearing nurses saying we don't like sickle cell patients on this floor, or sickle cell patients are very troublesome, and we don't want to deal with them. So they're hearing this side talk, and then when you're paying and you're hearing this, or people are just not paying attention to you, they're not giving you your medication, that's when they become problematic, and this is when they are reporting to say, this is not meeting expectation, this is below expectation. But in instances where they get what they wanted and they are treated right on time with respect, even with it from the triage nurse and all of that, then they would say this meets expectation or even exceeds what I was expecting to receive. And I would like
Thanks, Ms. Landry. I would only add that I do think that folks are at least hoping for some collaboration, which suggests that there are expectations. This is what works for me. I've come in expecting that. I'm experiencing a lot of delay and challenge getting what I know works or believe should work. So I do think that was not maybe a direct question, but it's revealed by some of the feedback and something in our next study that we can be more focused in collecting. So I appreciate the question.
Question for both of you. A curiosity, I saw when you presented the numbers, I believe a few 14% or something said that it exceeded the expectation. So I know that you said you were talking about adults and maybe pediatrics, so I'm not sure. I saw that some caregiver gave their opinion as well. So I don't know if it was really separated by adult and pediatrics, yeah. But I wanted to know if this small part of expectation, if you saw, if you could say, for example, if it was more from adults, from pediatrics, both, or how does it look like?
Okay, so you can, so the pediatric patient, which of course is their caregiver, that is doing the survey on their behalf. The caregivers, I would say that was about 46% in that range. That is from the pediatric population, and about 53-point-something% from the adults. So the larger number of dissatisfaction is from the adult population. Yeah. So a very few number of the pediatric were not happy, but most of the adults were not happy. You want to ask?
Sure. Just burning through our extra minutes. But I appreciate the question. I do think, even in the pediatric case, I think caregivers, again, based on history and what works for us, everyone's entering with an expectation, stated or not. I think you find out when you run up against resistance to the thing you have in mind and difficulty collaborating and sharing and planning together that you get those reports. Some would say, who is going to fill out a questionnaire like this? Would it be the happy folks? Would it be the folks that have challenges? And I think our efforts need to be to hear from everyone. But another good thing, I'm writing these things down, by the way.
Hi, thank you for the presentation. I think that's a really important study that you guys have put together. My only question is, you kind of just segued into it really well, but how did you go about finding respondents, and what are your plans for expanding the study?
How did we find respondents to this survey?
Oh, how do we find? So that's a very good question. We actually send it into the community through, so SCAGO itself has its own WhatsApp platform, which has currently close to 500 family members there. So it was promoted there. We also send it on social media. We send it to hospitals who are willing to. But the challenge we have with hospitals is that you have to have the, REB approval from each hospital. It was very challenging. We got REB approval from Veritas, which is an external, so it can be shared just, largely that way, because if we have to go to each hospital, you have to get approval from each hospital, and that's just not doable. But we did share it widely in the community through social media and our WhatsApp and all of those platforms.
Maybe a way to get more, a way to increase respondents would be, I think just right off the top, more places to advertise, places like this letting folks know that a survey like that is coming, having a longer window for collection, and maybe even some information and sessions about what the study is purporting to do to draw folks in. And then looking at what we get and figuring out who we're missing. So I think there are a lot of approaches. Thank you for the question.
Okay. The beauty of where we find ourselves in the agenda is their poster will still be up, and they'll be available in the poster room during the lunch break. I am mindful of time, and folks need to get a bio break, nourishment, food, etc. So before I close for the morning, can I just ask folks to give one more round of applause for Ms. Langford, Dr. Newton, Dr. Rivlin,